Hi, it's Maureen Dwight, and I'm here to talk to you today about our Healthy Back online exercise program. What's unique about this program is it's designed to help people who've had back problems or are recovering from back problems to exercise safely and get more active. The program is designed around a 6-week session. And what we see is that people will be attending for all 6 weeks, and it's going to progressively build over time. You will be studying or learning more about your body in each session as you work with our professionals. Each session is 30 minutes long, and it is followed by a 10-minute question period where you can ask your instructor about some of the challenges you might be having in the class or how to progress or what it is that you felt. We have limited the class to 30 minutes as we feel that this is enough to get people what they need from their back care exercises. And we have carefully selected the exercises that we are doing each week, and we are building upon them. Our program is based on what's called a directional preference. As most of the people taking this class will have learned their directional preference from their therapist at the Orthopaedic Therapy Clinic, this may not be a new concept for you, but it's a very important concept of working within what your back prefers to do and avoiding what your back does not like to do. So in this program for this series, we're working with a neutral preference. And that means that the back is not fully into flexion, which is bending forward, or extremes of extension, but is held more in the middle, which is where most backs are quite comfortable exercising. We are, however, going to give you modifications for if you need a bit more of a flexion bias or a bit more of an extension bias. And we're also going to give you tips and tricks on how to activate the right muscle if you are not feeling it. If you want to learn a little bit more of what to expect in these classes, we have videos by John Gray and Aniela Amiel on what you can expect from each class. It will walk you through a bit more so that you're more comfortable with what you are committing to for the next 6 weeks, because we want you to commit and to build on a good base and leave a stronger, healthier body at the end of this. So a couple of tips for making the program work better. First of all is if you know your directional preference, you're going to use it. If you've learned how to activate things correctly from your therapist, we recommend you use that as well. However, you might learn some new tips and tricks also from our instructors, because they might teach you in a slightly different way that should resonate with you, perhaps, and teach you how to do this a little bit more easily as you move along. You're going to move at your own pace. If you need to take a little time out, if you need to wait for the modification, you take what you need, because the important thing here is learning to do this without pain and to build the strength and mobility you need to do well. If these classes seem to be what you need, then give us a call at the clinic or click on the link at the bottom of this video, and it will take you to the email to register for the class. We are only taking 10 people a class, so we hope to see you there. Give us a call and we'll help you get registered.